Good morning, Mr. Lee and fellow classmates. Today we are going to discuss about a serious topic among pregnant women called abnormalities and loss versus normal pregnancy. So in order to know about the abnormalities that are faced during pregnancy, we need to know about the procedure of a normal pregnancy. So a pregnancy is defined as the period in which a fetus develops inside a woman's womb or uterus. It occurs when a sperm fertilizes an egg after it's released from the ovary during ovulation. The fertilized egg then travels down into the uterus, where implantation, the process of the embryo sticking to the wall of the uterus, occurs. A successful implantation results in a pregnancy. Pregnancy lasts around 40 weeks or 9 months, and during that period, there are three segments to it called trimesters. The first trimester is where the embryo starts to form all its major systems. By the end of the eighth week, the embryo now resembles more like a baby, despite the head being proportionally larger than the rest of the body. The embryo is now considered a fetus. By the end of the first trimester, the organs and body systems are mostly, if not fully, developed. The fetus is now around 6.3 centimeters from the crown to the rump and weighs around 15 grams. The fetus is most vulnerable in this period to miscarriages because it is rapidly developing, and when it is exposed to harmful substances like drugs and alcohol, the organs may be damaged in the process. The parent will experience discomfort during this time, with issues like fatigue, nausea, and mood swings affecting their daily life. The second trimester is where the fetus will start to gain weight and grow, as the organs begin to function as well. By the time the halfway mark is reached, the fetus will develop some hair, fingerprints, and skin will form, and the fetus is large enough for the mother to feel its movements. The fetus will develop a layer of fat to provide warmth to it, and an ultrasound test may be done to determine the gender of the baby at around 18 to 22 weeks in. By the end of the second trimester, the baby has further developed to survive outside the womb. One example being the lungs producing surfactant that which helps it to inflate so that the baby is able to breathe outside. The fetus is now about a kilogram heavy and 35 centimeters from the crown to the rump. While the initial discomfort from the first trimester is gone, the mother may experience further symptoms such as gaining a lot of weight, experiencing backache, and feeling dizzy at times. The third trimester is where everything comes full circle as the parent prepares for labor. At this point, the fetus is gaining weight very quickly, the bones hardening and the fetus putting on even more layers of fats to survive outside. By the 34th week, most of the organs and systems are almost able to function on their own, the brain learning, making the connections to operate the baby's body. The baby makes final preparations before delivery by removing the fine covering of body hair called lanugo, removing a substance called vernix caseosa, and moving into a head down position called the cephalic position. As the weeks get closer to delivery, the parents will experience yet another wave of increasingly uncomfortable symptoms, such as Braxton Hicks contractions to prepare the parents for labor, heartburn, and needing to use the bathroom more often due to something called lightening. And finally, after the 9 months of keeping the baby in the womb, the parent will finally undergo labor, where the baby exits via the vagina. The average baby will weigh around 3.5 kg and measure at around 50 cm from the crown to the rump.
A major cause of abnormalities and loss is miscarriage. A miscarriage is defined as a loss of pregnancy during the first 20 weeks of gestation. Miscarriage occurs in about 15 to 20% of all pregnancies and most occur during the first 12 weeks. In the first few weeks of a pregnancy, a miscarriage can happen because a fertilized egg did not properly form a fetus. In most cases, the activity of the fetal heart will stop a few days or weeks before symptoms appear. Miscarriages and possible miscarriages have many categories, such as inevitable abortion or miscarriage, which is considered as such when there is bleeding from the uterus and the cervix is opening, but both the fetus and the placenta have not passed out of the woman's body yet. One of the most common signs of miscarriage is vaginal bleeding, although not all pregnancies with bleeding end in a miscarriage. Another common sign of miscarriage is cramps or pain in the abdomen, lower back, or the pelvic area. A decrease in the usual signs of early pregnancy, such as nausea, can also be a sign of miscarriage. However, this symptom rarely signifies miscarriage, as these symptoms normally disappear in healthy pregnancies. The five most common causes of miscarriages are genetics, infections, anatomic problems, clotting disorders, and age. About half of all first trimester miscarriages is because of chromosomal abnormalities. Chromosomal abnormalities mostly refer to the fetus having more or less than 46 chromosomes. This occurs more frequently in women greater than 35 years old. When a woman is below 35 years old, the average risk of miscarriage is 15%. When the mother is over 45 years old, the average risk of miscarriage is 50%. The second most common cause of miscarriage is infections, as infections of the uterus and cervix can be very dangerous to the developing baby. It could even lead to miscarriage. Other types of infections can also be passed on to the fetus or the placenta, which can affect the fetus's health and lead to loss. Anatomic problems such as defects to the uterus cavity can cause the woman's uterus to not form properly, and therefore not being able to support a healthy pregnancy. Clotting disorders can also cause the body to form more blood clots than normal. This can cause blood clots to form in the placenta, and this can prevent nutrients and oxygen from getting to the fetus and prevents waste from being carried away. Most miscarriages are due to genetic abnormalities or other health factors which is beyond the woman's control. Therefore, not much can be done to prevent it. The most the woman can do is to keep herself as healthy as possible by eating a well-balanced diet, exercising regularly, avoiding smoking cigarettes, alcohol, and drugs, and reducing caffeine intake to 200 milligrams or less every day. However, there is no evidence that such measures can reduce the risk of miscarriage. This is because miscarriage is not caused by minor stumbles or fall, physical trauma, or minor accidents. The first treatment is expectant management, which is to watch carefully for symptoms by letting tissues pass on their own. If the pain is too severe or bleeding is too heavy, the second treatment is called dilation and curettage, which is to gently stretch open the cervix and to remove the remaining fetal tissue from the uterus. The third treatment is to use medicine placed in the vagina or between the cheek and gum to promote the passage of tissue. This can be more appealing as it can avoid procedures such as dilation and curettage, and this can be faster than expectant management.
Breech position is when the baby positions itself bottom facing the cervix. Usually, when the baby develops, it will be in this position, and during its third trimester of development, which is usually in weeks 32 to 38, it will turn to be in a cephalic position, which is when the head faces the cervix in preparation for birth. A baby is considered a breech baby if it has not turned by 35 to 36 weeks. Usually, 3 to 4% of all births are breech babies. Normally, when a baby does not turn to face the cervix, it might be because of the following problems. Firstly, we have uterine abnormalities. Usually, the uterus is shaped like a hollow upside down pear, but in some cases, the uterus develops differently. This misshaped uterus might not give enough space for the baby to turn. Next, the location of the placenta could also affect whether the baby is a breech. If the placenta of the mother is located near the top of the uterine wall or is covering the cervix, this could prevent the baby from turning as it is blocking the baby's head. A difference in amniotic fluid in the womb can also prevent the baby from turning, as there is not enough fluid for it to move around in. If the mother or father of the baby was a breech baby, the chances that the baby will be a breech is higher. This cause is still being researched. There are multiple methods to treat such breech babies. The first method is called external cephalic version, in which the doctor would try to manually turn the baby. Usually, the doctor would carry out this procedure from 36 to 38 weeks. The doctor would apply pressure to the mother's stomach to turn the baby. The following methods are natural methods. The mother would lie on the floor with her legs bent. She would then lift her hips and pelvis into a bridge-like structure and would have to stay in that structure for 10 to 20 minutes to encourage the baby to turn. This is called the breech tilt. The last natural method is called the forward-leaning inversion, in which the mother would rock back and forth on her hands and knees for 10 to 15 minutes. After all these methods, and it is still not possible to turn the baby, the mother has two options on how she would like to deliver the baby. She could have a caesarean section, which would involve the mother's womb being cut open to remove the baby, or she could deliver the baby through labor. The survival rate of breech babies delivered through caesarean section and through natural labor is 1.6% and 5.1% respectively as of 2017.
There are many different types of birth defects, so I'll be focusing on one of the more common ones, which is heart defects. I'll be referring to them as congenital heart defects, also known as CHDs. Heart defects affect, of course, the heart. Well, more specifically, the structure of the heart. The walls of the heart, the valves of the heart, and etc. The severity of the cases varies by a lot, from hardly doing anything to literally blocking the passageways of the heart. I won't be covering all the causes as we don't have time. The causes of these CHDs are all linked to the mother. Some cases are linked to genetics, whereas others are linked to the mother's health. Does she have any illnesses, such as diabetes? Does she suffer with obesity? Did she smoke during her pregnancy? All of these things could cause CHDs in the child. Previously, I had mentioned that the severity of the cases varies by a lot. This carries over to the symptoms too. Some cases have no symptoms whatsoever, some have all of them. But typical symptoms include the baby being breathless, a blue tint in nails or lips, and sleepiness. More sleepiness than a normal baby. Okay, so there's all these issues. There has to be a way to prevent them, right? Well, that may be true for some cases, but more often than not, they can't be prevented due to genetics being a large factor. The best way, however, is to mitigate risks by leading a healthy life as a mother or a pregnant woman. Fortunately, there is treatment, although it varies depending on the baby. Some children might need 1 or 2 surgeries to repair certain blood vessels in the heart. Some children might even need a heart transplant. Some might not even need surgery. However, this treatment usually doesn't count as a cure, as most of the time, all the symptoms don't go away, they're just lessened.